Next is the Valdier lymphatic ring. So there is a ring shaped arrangement of lymphoid tissue that is located in naso-oropharyngeal isthmus. So that is a region connecting the nasal and oral cavity. So this ring, it is composed of several important aggregates of lymphoid tissue. Consisting of the lateral side, there is the palatine tonsil. So these are the most significant component of the Valdier ring and located on both right and left side of the throat. Other are on the dorsal side, there are the nasopharyngeal tonsil. So they are positioned posteriorly and above. So this tonsil is located in the nasopharynx, the upper part of throat, behind the nose. On the dorsolateral side, there are the tubal tonsil. So these are the tubal tonsil. So they are found laterally and above. These tonsils are in close proximity to the opening of the auditory tube in the nasopharynx. And another are on the ventral surface, there are the lingual tonsil. So they are situated inferiorly on the posterior part of tongue dorsum. The lingual tonsil is involved in protecting against infection in the oral cavity. So this was all about the Valdier ring. Now coming to the laryngopharynx, it extends from the C3 to the lower border of cricoid cartilage, that is 6. That is the extent of the laryngopharynx. The boundaries, it extends from posteriorly from C3 to C6. Anteriorly from above downward, there is inlet of the larynx, that is this one is the laryngeal inlet. Then there is posterior surface of arytenoid cartilage containing aryepiglottic fold, and posterior surface of the lamina of the cricoid cartilage. So this one is the posterior surface of the cricoid cartilage. The posterior wall, it is supported mainly by 4th and 5th cervical vertebra, with partial support from the 5th and 6th cervical vertebra. On the lateral wall, you will see a depression. So this one is the depression that is known as piriform fossa. So piriform fossa, remember, it is an important anatomical feature in this region. It is a depression that plays a role in swallowing. So the boundaries of fossa includes the aryepiglottic fold that is present medially, and thyroid cartilage and thyroid membrane that is present laterally. So you have to remember that there is a nerve that is known as internal laryngeal nerve. So which nerve lies close? It is situated beneath the piriform fossa. So this one is the piriform fossa, and this is the internal laryngeal nerve that ramifies beneath the mucosa. So caution during foreign body removal. So while removing of the foreign bodies from this piriform fossa, it carries a risk of damaging this internal laryngeal nerve. So that such damage may cause damage to this nerve, can lead to loss of sensation in the supraglottic part of the larynx, affecting the upper portion of the voice box. So remember that the piriform fossa is a little pocket or dip in the throat, just like a small hidden space. So that is why this is also known as a smuggler's pouch. So that is used to compare it just like a secret pocket where things might get temporarily stuck. Just like how the smugglers they hide things in the secret pocket to avoid detection. So piriform fossa, it can trap the food or other small particles for short time before they can continue their journey through the digestive tract. And the damage or removal of foreign body from the piriform fossa carries a risk of damaging the internal laryngeal nerve. Now pharynx, we know it's a tube-like structure connecting the nose and mouth to esophagus and larynx. It has 5 layers in its wall. What are those? The first layer is the mucosa. The second, the innermost layer is the mucosa. It is responsible for producing mucus. The second layer is the submucosa. It lies beneath the mucosa and contains various structures like the blood vessels, gland and connective tissue. And it provides support to the mucosa. The third is the pharyngobasilar. So this is the pharyngobasilar fascia, a fibrous sheet internal to the pharyngeal muscle. So it is thicker in upper part, filling the gap between the upper border of superior constrictor and base of skull. So it attaches superiorly to various skull structures and disappear inferiorly deep to the muscles. The other is the muscular coat that consists of outer circular layer that is made up of 3 constrictor muscle. They are superior constrictor, middle constrictor and inferior constrictor, and inner longitudinal layer that is composed of tylopharyngeus, salpingopharyngeus and palatopharyngeus muscle. Next is the buccopharyngeal fascia. So covering the outer surface of constriction of the pharynx. So this fascia extends across the pterygomandibular raphe to cover the buccinator muscle. So it is more developed in the upper part of the pharynx. So between the buccopharyngeal muscle, between the buccopharyngeal fascia and this muscle coat, there are plexus of veins and nerves. So that helps to coordinate various functions of the pharynx. The muscle coat, as discussed, it consists of 3 muscles, the inner longitudinal muscle and outer is the circular muscle. The 3 muscles, they are tylopharyngeus, salpingopharyngeus and palatopharyngeus, whereas the constrictor muscles, they are superior constrictor, middle constrictor and the inferior constrictor. Now let us discuss the origin of constrictors. The superior constrictor, it takes origin from following: from above to downward. There is the superior constrictor, there is pterygoid humulus, pterygoid raphe, and the C is the medial surface of the mandible at posterior end of the mylohyoid line and the side portion of the tongue. Whereas the middle constrictor, it takes origin from the lower part of the stylohyoid ligament, lesser cornu of hyoid, this one is the middle constrictor. The inferior constrictor, it consists of 2 parts. One part, the thyropharyngeus, it arises from the thyroid cartilage, and the cricopharyngeus, it arises from the cricoid cartilage. So the thyropharyngeus, remember, it arises from the oblique line on the lamina of the thyroid cartilage, including the inferior tubercle. So remember, all the constrictor of the pharynx, they are inserted into the median raphe on the posterior wall of the pharynx. The upper end of the raphe, it reaches the base of skull and it is attached to the pharyngeal tubercle. on the basilar part of the occipital bone. The longitudinal muscles, they include the stylopharyngeus muscle. The stylopharyngeus originates from the styloid process, and it is present between the gap between the middle and superior constrictor, and it inserted into the posterior border of the thyroid cartilage. It helps to elevate the pharynx, and the nerve supply is by, remember the nerve supply, it's by glossopharyngeal nerve. The palatopharyngeus originates from palatine aponeurosis inserted into the pharyngeal aponeurosis, and nerve supply is the cranial part of accessory nerve through the pharyngeal plexus. The salpingopharyngeus originates from auditory tube, and nerve supply is cranial part of accessory nerve through the pharyngeal plexus. So remember, all the constrictor of the muscle of pharynx, they are supplied by the cranial part of the accessory nerve. Remember, the inferior constrictor has additional nerve supply from external laryngeal and recurrent laryngeal nerve. Next is the sinus of Morgagni. It is a semi-lunar half moon shaped gap between the upper concave border of the superior constrictor and the base of skull. So the upper strong part of the pharyngobasilar fascia, it closes this gap. Through this sinus of Morgagni, the structure passing are this one is the auditory tube, the muscle that is levator palatine, and ascending palatine artery. So just remember them. In the gap between the superior and middle constrictor, the structure passing are the stylopharyngeus muscle and the glossopharyngeal nerve. From the gap between the middle and inferior constrictor, the structure passing are the internal laryngeal nerve, that is branch of superior laryngeal nerve, and superior laryngeal vessel. And for the gap between the inferior constrictor and esophagus, the structure passing are recurrent laryngeal and inferior laryngeal vessels. The next is the Killian dehiscence. What is that? So remember that it refers to specific area in the posterior wall of the pharynx. The lower part of the thyropharyngeus muscle, it is single sheet, and it is not covered by superior and middle constrictor. So due to this weak area, it is located below the level of the local cords, and it is bounded at bottom by thick criccopharyngeal sphincter muscle. So this region, it's known as Killian dehiscence, and because of it can give rise to a pouch-like diverticula. So these are the Zenker diverticulum or the sac. So these diverticulum, they are formed by the out pouching of the weaker area. So remember, Zenker diverticulum occurs due to the neuromuscular incoordination between thyropharyngeus and criccopharyngeus muscle. So when the thyropharyngeus contract, the criccopharyngeus would fail to relax. So if the criccopharyngeal muscle fail to relax properly, when the thyropharyngeus contract during swelling, the food bolus can be pushed backward, leading to formation of diverticulum. Now the arterial supply can be due to the branches of facial artery, that are the ascending palatine artery, tonsillar artery. Branches of the external carotid artery, those are ascending pharyngeal artery. Branches from the lingual artery includes the dorsal lingual artery. Branches from the maxillary artery includes greater pharyngeal artery, and artery of pterygoid canal. The venous drainage is through pharyngeal venous plexus that drains into internal jugular vein and facial vein. The nerve supply is pharyngeal plexus of vein that is formed by the pharyngeal branches of glossopharyngeal nerve, pharyngeal branches of vagus nerve, cranial part of accessory nerve, and the pharyngeal branches of superior cervical sympathetic ganglion. So all the muscle of pharynx, we discussed that it is supplied by cranial part of accessory nerve except stylopharyngeus. Stylopharyngeus is supplied by glossopharyngeal nerve. The secretomotor is through the pharyngeal branch of pterygopalatine ganglion, and the sensory nerve supply is through 9th and 10th cranial nerve. The taste sensation is through internal laryngeal branch of vagus. The lymphatic drainage through the retropharyngeal lymph nodes, parapharyngeal lymph nodes, or the deep cervical lymph nodes.